Diabetes in India is a growing health problem with more than half of the population at risk of developing the condition at any given time in their lives. Diabetes mellitus is a widely diffused chronic condition that impacts several aspects of patients' lives. If you do not manage this condition, you may develop more severe complications. There is no cure for diabetes, but with well-managed diabetes, you can prevent many complications of diabetes. Diabetes management is about more than blood sugar control. More people are still unaware of this fact. There is much debate around the cure and reversing of diabetes. People are being misled by half-truths or inaccurate information. There are several misconceptions about diabetes management and treatment, so it is important that people get correct information about it. To discuss these and other issues regarding diabetes, we have with us today an esteemed panel of experts. So if you have any questions you would like to ask them, please send them to us via WhatsApp. The number is +91 9167 666 941. That is the number to send us your questions. For our experts to also please send in your name and your location. Today we have with us Dr. Jothydev Kesavadev, Member Task Force on Diabetes Technology, RSSDI, Chairman Jothyadev's Diabetes Hospital and Research Centre, Trivandrum, Kerala, Dr. Sanjay Aggarwal, National Secretary, RSSDI, Head Department of Medicine and Diabetes, Ruby Hall Clinic, Pune, and Dr. V. Mohan, Past President, RSSDI, Chairman of Mohan's Diabetes Specialty Centre, Chennai. Thank you all so much, doctors, for joining us today on this very important issue which we are going to be discussing. Starting with you first, Dr. Aggarwal, we have the first question from our viewer and the person wants to know, it's come via WhatsApp, that it's a very basic question on diabetes. The viewer would like to ask that, do people with diabetes gain weight or lose weight?
So, Ambika, I think that's an excellent question the viewers asked us.
Yeah.
Remember that insulin is an anabolic hormone. It builds tissues.
Yes.
So any condition where you have absolute lack of insulin, you're going to lose tissues, be it the fat, be it the muscle. And that's one of the main reasons people tend to lose weight. This is true in patients who have type 1 diabetes or severe type 2 diabetes where there's hardly any insulin that is being made from the pancreas. And whenever you replace insulin, you find that the patient starts gaining weight. On the other hand, you have obese people where the fat interferes with the action of the insulin. And you find that the pancreas is unable to compensate adequately for the blood sugar control. Here you find that there's hardly any change in weight, but the treatment is, of course, weight loss that you need to initiate. And then there's, of course, a third part of it where you find that you may actually gain weight because of unhealthy lifestyles, or the medications that we use for control of blood sugars at times can also paradoxically cause an increase in weight. Even insulin itself can cause a weight gain or some of the other oral medications. So here the treatment is, of course, trying to combine medications which cause a weight loss with medications that cause a weight gain. And when it comes to unhealthy lifestyles, you, of course, need to concentrate and advise your patients to eat healthy food and exercise more. So I think it's a very complex problem, the relationship between weight and diabetes.
Yes, absolutely. Thank you for explaining that. Moving on, Dr. Mohan, there are various medications available for the treatment of diabetes. And some people here need oral medications while others may need insulin injections. Can a person on oral medication take insulin, and can a person on insulin switch to oral medications after achieving long-term control of blood sugar?
Thank you very much for the question. It all depends on which type of diabetes you have. Now, if you have type 1 diabetes, they are insulin dependent and therefore they have to take 3 to 4 injections lifelong of insulin, and if they stop insulin, they will die. On the other hand, we have type 2 diabetes, and in type 2 diabetes, what happens is that most of the patients do not need insulin and they can be controlled with tablets. After many years of using tablets, the pancreatic beta cell function may go down and they may need insulin. We also do give insulin to type 2 patients if they are very sick, they are in hospital, if they have COVID, for example, or going a surgery, and so on and so forth. This can be just short term. So people who are on insulin, after some time, we may stop the insulin. People who are on tablets may go on to insulin. So it is not that if you're once on insulin, you can never stop the insulin if you have type 2 diabetes, or that if you have tablet, you would never need insulin in your lifetime. So for type 2 diabetes, both can be used interchangeably. The physician will decide when to give it. Please listen to your doctor. If they tell you that a short course of insulin for a month can help you, don't think it's going to be addicting, as they call it, because after that short course, your whole pancreas may rejuvenate. It may regenerate in some ways. Your pancreatic beta cell function may go up. So always listen to your doctor. But yes, again, in type 1 diabetes, it is only insulin, insulin, and insulin.
And I think the most important, what you said, is to listen to the doctor, what he's recommending and telling the patient. Moving on, Dr. Jothydev, can a person get rid of type 2 diabetes if they stop eating carbs and lose a lot of weight?
The answer, Ambika, is no.
Okay.
It is very important that we should follow a healthy carbohydrate. It is a vital important. And even in the presence of diabetes, we should consume carbohydrate. And the carbohydrate that we should be consuming should be contributing to at least 50 to 70% in the diet. So a carbohydrate, it is a fuel. And that is the energy for all the vital tissues, including the muscle, the brain, and so on. So there is no life without any carb. And if you ask me the benefits of weight loss, even if 5 to 10% of weight is lost, especially if we are overweight or obese, it will have phenomenal benefits. So weight loss in an overweight or an obese individual will have phenomenal benefits, and that is beyond lowering the glucose. You can lower the cholesterol, you can lower the blood pressure, and you can ultimately lower the risk of a heart attack or a kidney disease. But remember, many studies are there. There are a couple of studies, and there is a recent meta-analysis of more than 61 studies which has shown that lowering the carbohydrate will have some benefits initially. But these benefits, including the benefits of weight loss, is not consistent. So whenever you are following a diet, or whenever you are following other healthy lifestyles, or whenever you are planning to execute a new therapy, remember, number one, you should be realistic. Number two, you have to consult your physician and your registered dietitian. Very, very important.
So while weight loss is important, I think something what you really put out there is not like giving up carbs or leaving food, but follow something which is consistent and which is doable. Dr. Aggarwal, many articles claim that weight loss surgery, also called the bariatric surgery, can treat type 2 diabetes and help reverse type 2 diabetes. Is this true?
Yeah, I would say yes and no to a certain extent. Remember that people who are morbidly obese, they really don't have too many options other than going for weight loss surgery, what we now term as metabolic surgeries. So it's just on one hand, you find that, the benefits are in terms of blood sugar reduction, but on the other hand, just losing weight helps them to overall improve other medical problems, just as, hypertension, risk for heart disease, strokes, orthopedic problems, risk for cancer, and so many other problems. Now, whether a weight loss surgery is going to get rid of a person's sugar depends on how much inherent insulin the patient is making. If you pick up the patient early in the course of the disease where the pancreas are still making the insulin, then a weight loss surgery is going to help this patient to get their blood sugars under control, and probably they may be able to get rid of their medications. This is something like a reversal of diabetes that we talk about. But on the other hand, if you're seeing the patient very late and you're instituting a weight loss surgery very late, where the pancreas is really not making enough insulin, then in these sort of situations, we're not going to get rid of the medications, but at the most you may find that the need for medications may come down. Okay. Obviously, the lower the amount of medication that you can give, the risk of complications related to medicine also come down. But you may not get off the medication. And a good way of estimating this, at times what we do is test what we call as the C-peptide estimations. The C-peptide is an estimation of how much of insulin the pancreas is putting out. And if you find that there's enough C-peptide, there's every chance that the weight loss surgery will benefit in terms of getting the blood sugars down. Okay. So it's kind of multifactorial. Weight loss itself is benefited, But don't do it only because you want to lose weight or you want to get your sugars under control. It has a more wider benefits beyond just weight, beyond weight or sugar control.
Okay, thank you for explaining that, Dr. Aggarwal. I mean, in fact, Dr. Mohan, the next question which I want to ask you is that what are the types of bariatric surgery? What are the overall health benefits of the surgery? Are there any side effects that a person must know before surgery?
Thank you, Ambika. Actually, there are 4 types of bariatric surgery, of which the first one is virtually gone. That's called banding. We just put something like a rubber band, a tight band, and then don't allow enough food to go into the stomach. That's gone because it starts expanding after some time and loses its effect. The 3 which are being practiced now, the first one is called as a sleeve gastrectomy. What it simply means is that the stomach is cut to about half its size. That means you can eat only half the amount of food. And remember, these are permanent surgeries. Reversing these surgeries is very difficult. So once you decide to go for a metabolic surgery or a bariatric surgery, remember it is lifelong. So the simplest is a sleeve gastrectomy. Just cut the stomach. Now this is quite effective for weight loss, but not much for reversal of diabetes. The second one is called as a Roux-en-Y bypass. Basically what it means is that the stomach is being bypassed, not to the next part of the intestine, but to the next part of the intestine, the second part of the intestine. So by that process of bypass, you are getting rid of some part of the intestine and some hormonal changes are brought in, which reverse diabetes. Now, in this case, the reversal of diabetes is better than with sleeve gastrectomy. But as Dr. Sanjay Aggarwal said, even this has to be done in early stages. One of my students did a PhD on this, one of my doctors. And what we found was the first 8.5 years are very important if you're planning reversal of diabetes or remission of diabetes through bariatric surgery. After about 8 to 10 years, you don't get it. The last one is called the Ileal Transposition. This is not done everywhere in India, but a few centers do it. Much better for reversing diabetes, but it's not one of the most popular techniques. Now, coming to side effects, of course, you do have side effects because it's a major surgery, not something like a small hernia or cataract surgery and so on. This is a very major surgery. You open the stomach, you're cutting it, half the stomach is gone, you're stitching it to the intestine. Lifelong, you have the risk of getting anemia or developing vitamin deficiency. So you definitely have to take vitamins throughout your life. Also, because of the weight loss and due to the surgery, you can develop gallstones. So you may need one more surgery. And worst of all is that there is a mortality rate associated with it. About 0.5%, which means that 1 in 200 people will die. So it is not something which everybody can do. And you can't do it in millions of people. It's not a panacea. Every type 2 diabetes patient just go and get a surgery and then you're cured. It's not so simple. And there are much better. Today, we have medicines which have come, which are working like bariatric surgery. We've got a small pill which has come. And that pill, if you take, can lose 10, 15 kilos without much of side effects. So why would you go and do bariatric surgery? As Sanjay Aggarwal said, only in the worst cases, the most morbid cases, you should.
I think that's really well put because one should know the side effects, and thank you for bringing that out. Dr. Jothydev, how do environmental pollutants affect the development and progression of type 2 diabetes mellitus?
Well, that's a fantastic question. I would like to congratulate the person who asked that question because that is not an usual question. Anyway, there is a growing evidence that environmental toxins are responsible for type 2 diabetes. Because till date, there are more than a dozen reasons for the causation of diabetes. And those reasons are well established. But now there is a growing evidence that some of these environmental pollutants, such as the tobacco smoke, for example, the automobile exhaust, nitrogen dioxide, some of these pesticides, all of them can induce something called insulin resistance. That means the insulin, the hormone which is responsible for reducing the glucose, becomes inefficient, ineffective in appropriately normalizing the glucose value. So what can we do? Because it is very difficult to avoid all these pollutants. But remember the fact that even though we are blaming the environmental pollutants, still the major reason for the unprecedented rise in the type 2 diabetes, it is because of sedentary lifestyles, abdominal obesity, lack of physical activity and so on. So my advice will be, of course, continue with your physical activity, reduce your body weight. And if, I don't know whether I am right or wrong, there could be a role for the mask which we are currently using during these COVID times in avoiding environmental toxins to an extent. But we probably will require more studies on this. But until then, exercise, executive checkup, and healthy diet.
Dr. Aggarwal, we do know that self-monitoring is very important, and self-monitoring of blood glucose is essential for people with diabetes to maintain tight control over their sugar levels. Their use, importance and frequency are different in type 1 and type 2 diabetes. Could you please explain the differences between the monitoring requirements in both the types of diabetes?
Excellent question, Amrika. We now have a lot of tools for glucose monitoring. Remember that glucose monitoring is very important to get a sense about how your sugar controls are.
Yeah.
Now, conventionally, we did have, a way of checking blood glucose by finger prick, where we have the glucometers and you prick your finger and check the glucose and you get an instant blood sugar reading. Now, there has been, of course, a lot of new advances that has happened, and we have something like what we call as continuous glucose monitoring. Let me sort of give you an analogy. It is something like you watch a movie versus a photograph. If you want to get a real-time assessment of how the blood sugars are behaving in the body, then you need to do something called as a continuous glucose monitoring, which gives us an assessment about the variation of the sugars in the entire day, number one, and how much percentage of time a person stays in the normal range, and index what we call as time in range. These have become the new matrix for assessment of blood sugars, whereas these are not sort of routinely possible for everybody or to do it routinely. We do still rely on the finger prick method. The frequency depends on the kind of treatment, the underlying condition, and what are you really aiming to do, whether you're trying to get a sense about regulating the doses of the insulin or the medications. So if you're sort of putting the patient on insulin, you want to test them more frequently. One, to adjust the dosing. Two, to see whether they're getting frequent any low sugars, what we call as hypoglycemia. So this kind of gives us an idea that how much of dosing changes that you need to do. Whereas patients who are on oral medications, you don't need to do it very frequently. But at times, we do need to do that, particularly in high-risk situations, patients who have got, let's say, a kidney failure or a heart failure, or patients who have got liver failure, where there is a risk for low sugars. In those sort of situations, you need to sort of test them more frequently.
Okay.
So the continuous glucose monitoring and the finger prick complement each other, and we need to decide what works best for the patient.
Okay, so they both have, it depends on what type of diabetes, and obviously it's individualized. Dr. Mohan, it is natural for people with type 2 diabetes to worry about the possibility of passing their condition on to their children. Should they be apprehensive about this, and what can they do to ensure that their children do not have diabetes?
Excellent question. I don't think they should be apprehensive about it. I think they should take it as an opportunity. Now, about 40 to 50% of type 2 diabetes is genetic, which means that if both the parents have diabetes, the risk of the children getting diabetes is close to 90%. By the time you age 50, there will be very few children who don't have diabetes if both the parents are diabetic. Whereas if one parent is diabetic, the risk comes down to 50%. Now, what can you do to prevent it, and what do we mean by prevention? Now, remember, the other 50% is due to environmental factors. Dr. Jothydev mentioned obesity, lack of exercise, eating junk foods. These are the main reasons. Although environmental factors we have shown in one study is about 4% only of the cause of diabetes. So if you reduce weight, if you are healthy, if you eat healthy, if you exercise regularly, if you sleep on time, you can actually postpone getting diabetes. Both parents are diabetic. The children may get it when they're 18, 20 years old. So imagine by the time they're 40, they can develop all the complications of diabetes, because it takes only 20 years to develop complications. What if those children were brought up in a very healthy manner by the parents, and they push their getting diabetes to say 40 or 50 years of age? It then takes another 20, 30 years to get complications, because the older you get it, the milder it is. So only when you're 80, you need to worry whether you'll develop complications. Currently, India's lifespan is 68 years for men and 70 years for women without diabetes. So if at 80, 85, you have to worry about complications of diabetes, I think that's much better than facing blindness or kidney failure or heart attacks at 40. So a lot can be done. So instead of being apprehensive, I think we have to accept the fact that diabetes runs in families. And in this context, I'd like to tell you a joke in a lighter vein. It's not that diabetes runs in families. Diabetes comes because nobody runs in families.
That I think has really put it. I think it's put the whole thing together. It summed it up really well. And what you said also, Dr. Mohan, that one can postpone it. So the right lifestyle is what is really, really important. Dr. Jothydev, having a silent heart attack again puts you at a greater risk of having another heart attack, which could be deadly. Why do people with diabetes experience silent heart attacks, and how can one prevent it?
First of all, Ambika, the answer is don't be afraid. Don't be scared of a silent heart attack because it is detectable and it is preventable.
Okay.
And diabetes for a long time has been established as a silent killer. And why diabetes is established and described as a silent killer? The reason being the silent heart attacks. The heart attacks can happen in a person with diabetes without any pain. And how does it happen? And this is a continuation of Dr. Mohan sir has said, you need to control diabetes. If long years of uncontrolled glycemia, for example, 5 to 10 years of high glucose values, and if you are not properly controlling the disease, and then neuropathy sets in, that means the person won't be able to appreciate or experience the breathlessness or pain of heart disease. And this is avoidable. This is treatable. Remember what Dr. Sanjay said? There are newer methods of sensing. You can attach a sensor over your upper arm over here, and the sensor will automatically sense the glucose value once in every 5 or 15 minutes. And this will provide you with a rich data, robust data on glucose variability. Because when the glucose is going up and down, and when this metric is unacceptable, this is directly responsible for injury to the blood vessel, which again is responsible for the heart disease and other major complications of diabetes. So remember, when you are treating diabetes, it is beyond glucose. That is what we were all telling you. It is beyond glucose nowadays. And we should be, along with the usual treatments, integrating those treatments with cost-effective and affordable technologies. And that is how you can bring down the complications and ultimately you can save the cost, because the cost of diabetes is the cost of complications.
Thank you all so much, doctors, for joining us today and sharing all this expertise with us. I'm sure it's really going to help our viewers. Thank you all so much.